Daniel, you have some new results you're going to be presenting this week on Wednesday, so can you give us sort of an overview of the summary of that?
Right. Well, to start with, the men I'm seeing are part of this epidemic of sexually transmitted hepatitis C among HIV-infected men who have sex with men. I've been working very hard to work with the docs in the community and all around through New York City. And many of them have referred me patients. And I've been working on trying to improve the treatment. Treatment early in what we call acute hepatitis C, there's a window of opportunity where the treatment success is much higher.
And what would that window be in terms of time?
Well, time is the tricky thing. In the textbooks, we're talking about now approximately 6 months from the time of infection. The problem is that we don't really know when people are infected, actually. So what we usually base it on is the nice quarterly HIV monitoring visits, and somebody has a new elevation in their liver test suggesting a new infection, and the diagnosis then can be made quickly if the diagnosis is considered and tested, and it's hepatitis C.
And what did the treatment look like?
So the treatment for I'd say the last 8 or so years, really since the epidemic first unfolded, was pegylated interferon and ribavirin. And most people could get 24 weeks, although many needed 48 weeks, and some treatment centers used 48 weeks preferentially, but mostly 24 weeks. And the cure rate was really quite good, at least twice as good, and then about half as long as in chronic infection. So about 2/3, maybe a little under 2/3. I call it 63% looking through the literature.
Right. And so these are the people that are HIV positive have a lower rate than people who wouldn't have HIV.
Exactly. It's maybe genotype 1 infections, a quarter, a third at the most. So 63% is quite a bit better, and 24 weeks is quite a bit better than 48 weeks.
Okay, and your new regimen?
Yeah, nonetheless, that's still quite a long time to take interferon. And so with the availability of Telaprevir last summer, I decided that based on its rapid acting characteristics that I could probably treat much shorter, cut it in half again to 12 weeks.
Wow.
So I used a 12-week triple regimen and recruited consecutive patients, discussed it with them and said, I think it can shorten your treatment time, and I think based on the characteristics also we should be able to even increase the cure rate. And so I screened 40 men in the period between the drug availability, when I was able to prescribe it last summer of 2011, and this fall. And about 20 of them were eligible to be treated. Specifically, they had genotype 1 virus, they had a new enough infection, and they were on antiretrovirals that were compatible with Telaprevir, and they were interested in doing it.
Great.
So I treated 20 men, and what I'm presenting here at the meeting is the results through the end of treatment and 4 weeks after treatment is my main course. So it's called SVR4. It's a short period after, but what has been seen is that, in general, there are few relapses after week 4. So it's a reasonably good, although not that conservative, idea of cure rate. The traditional cure rate has been 24 weeks after stopping. Most are using 12 now, and 4 weeks is a little soon, but these are the data as they're coming out so far.
Right.
And what I found is that it's 17 out of 20 who finished treatment with an undetectable viral load, and 4 weeks later, all 17 of those still had an undetectable viral load. And in fact, those who I followed out as far as 24 weeks, there have been no relapses.
Well, that's
so well over half of them have gotten all the way to 24 weeks, and there are still no relapses. So and the men have been very pleased to be treated only 12 weeks.
So would this give you some recommendations about maybe treating sooner, or trying to find more infections in order to treat sooner?
Yeah, I think it's very important to identify that hepatitis C is the cause of the new ALT elevation that's found, to closely monitor men, I'd say quarterly, for the ALT elevation, certainly sexually active men. And then with this very high cure, this is 85%, which is really numerically much higher than the 60-ish percent.
With only 12 weeks.
With only 12 weeks, so it's better and half again as long. So I think that this is a real improvement for the first time in about 8 years since this has been published, and I think it's an improvement in the quality of life of men, and then prevents the downstream consequences of the chronic infection.
Okay, well, thank you very much.